All right, we are live.
All right, we are back from a short break. May 17th, we're talking about joint resolution from the House number 6, systemic racism and as a public health emergency. So committee, I don't know that I've heard anything today that suggests we need to move our decision making on this until January. Yet I mean, which is what we would do should we, let me start over. If we make changes to the resolution as it is now, there is no guarantee that rules would be suspended either in the Senate or in the House. And once it goes back to the House, then there's no guarantee that any changes we make would be accepted by the House, nor that rules would be suspended to get it back and then to the governor. Actually, it's just a resolution, doesn't go to the governor, just goes. So I'm fine with the resolution as it's written, and I think it does provide us with information that we need to continue our work. I think that we started some of this last year when we asked for dashboard information from the Department of Health. We also put money into both of our CARES and CRF funding for some of the organizations that are helping our BIPOC communities at least in my district, and I know in other districts, helping with translations and support. So I see this as a next step that allows for us to put the roadmap in place to a greater extent. But I don't want to ask anyone to vote on this immediately unless you're all feeling, as I am, that we can move forward. And I did talk with Senator Terenzini, who couldn't be here because of a work obligation. I did talk with him, and he is supportive of the resolution as it currently exists. So I do open it up for discussion at this point. Senator Cummings, was that a hand up?
Yeah, I'm thinking. I'm getting over Bourjang's implied bias against realtors. Because in my training, it was greatly emphasized that any discrimination was forbidden. And I've never known a realtor that stepped over that.
So this is, yeah, I mean, and there are a number of things that might be pointed out that are discriminatory practices as examples, especially that come from other states. But there are some things that we may be unaware of. So.
Yeah, I mean, red line, that's been gone for a number of years. The question is, how do you encourage or allow people? I guess where the sympathy I'm having with Senator Brock is the resolution is fine. But unless we start asking the question, why is there a discrepancy? Why do white people own houses? Well, I'm all alone trying to keep us from putting people in trailers where they develop no wealth, at least historically. If we put poorer people, some of whom are people of color, in stick-built homes, they'd develop wealth, but right now, no one can afford them. So I want to make sure that we just don't pass the resolution, say, yep, it's systemic racism, and go home and not delve into the whys and the wherefores.
You actually hit the nail on the head when you have data that indicates disparity. then the question is why? Why do we have those disparities, and how can we improve the situation through broader policies or education that that change the direction? And that raises the question, I think, that Dr. Avila brought up, looking up and looking at what other countries are doing. Frequently, we look at what other countries are doing in our healthcare environment and find, golly, Ned, we're paying a lot more for healthcare that has worse outcomes. So you really asked the right question. I don't have an answer for everything.
No, we don't.
Senator Hardy had a question, then Senator Hooker.
I don't have a question. I was just, you asked what our feelings about the resolution were. I think that there are things that could be improved in the resolution. I think, Joanne Crawford, our last witness, pointed to one, and those were improvements that we did make in H210 when it was in this committee, largely based actually on her testimony. I think that there are things that we could add that are more action oriented, little technical things that we could do, like who do we send it to and all that. However, given that we have 4 days left, and I do think that the path to getting it over and back and all that, it could be challenging. And I think that's important that we pass the resolution this session. It's unfortunate that it came to us so late, so we didn't really have a chance to really dive into it more. But I'm fine, acknowledging the sort of imperfections of it, but passing it given where we're at is sort of my opinion. And you're muted, Ginny, I don't know if you were trying to talk, but you're muted.
I was trying not to have sounds carry. Senator Hooker, thank you, Senator Hardy. That was well said.
Thank you. And I agree with Senator Hardy. And I just wanted to comment on Senator Cummings' concern in from what Mark Hughes said about the passage of the resolution in Chittenden County and how people stepped up to carry on the work. And I'm hoping that that'll be the case. I think that this is the beginning, as you said, Senator Lyons, just the first step or the next step in addressing this issue. And I do hear what Senator Brock is saying about, where are the laws? But we can't change our history, and the laws were there, and the impact of those laws is still being felt. So I think that to move this resolution now is a wise thing, rather than waiting until January or taking our chances that the House would suspend rules and get things done when they were working on it in the beginning. So that's it.
Okay. Yeah. Your comment about laws is important, that they may not be explicit. Things are more subtle now and nuanced and misunderstood or not understood at all. So, okay. Senator
My fan
Cummings.
is arriving. It's about 85 up here.
Oh my gosh. I know, it's getting to be summertime. It's time for the session to wind down.
It is.
Senator Cummings, you've heard, we've got three folks, actually four.
I'm fine. No, I said I'm fine. I just
Oh,
want to make sure it
You
doesn't
are
end.
fine.
Yeah.
All right, so here's my suggestion. I'm gonna suggest that we take a vote by hand and voice, and then I will turn to Senator Terenzini to confirm that vote. We might meet just before or right after. We have a meeting scheduled at 8:30 on Wednesday with Senate Judiciary on one of the mental health bills. If everyone is there, we can do a confirmatory vote. We'll make sure.
Okay, from now on,
No.
I'm not going to have miscellaneous tax in conference until Wednesday
Oh, good.
because education didn't take testimony on it when they had it. So my time is totally
Gone.
gone.
All
Yeah,
right.
you can
Let-
go
let's
ahead
see.
without me, but I can't.
We'll take a vote now and we'll hold the vote open for Senator Terenzini. My only question is who would like to be the reporter for this resolution? Because there will be a report. It is a bill. Okay.
I'm happy to do it unless you want to do it, Ginny. If you want to do it, you should do it. Otherwise, if you if you want me to, I'm happy to do it as well. I
Well-
think Senator Cummings is probably a little busy right now. So,
Yeah.
And if
No, I don't
Cheryl,
need to do it.
Cheryl, if you want to do it, that's fine too. I did H210 and it's very similar. So,
So let's do this. Why don't you take the lead on it, Senator Hardy? I'm glad to have you do that and thinking about H210. And then I will also chime in because it is a significant, it is hugely significant to us. But that would be helpful. Let's do that.
Okay.
All right. So all those in favor of passing JRH 6 as currently drafted, please raise your hand and say yes. Yes. Opposed? And I will follow up with Senator Terenzini, but at this point, he is supportive. And, but let's not send it upstairs until I've confirmed that with you, Senator Hardy, or he has confirmed that with you as clerk.
okay, sounds good. Thank you.
I have two appointments.
I do too. I have one.
And I've been told it only takes 3 days for them to be on the calendar, and I'm doubtful we're going home on Friday, so.
Okay, okay, who do you have? Because I have someone.
Okay, well, the
Oh,
first
thank
one
you
I
for bringing
have,
this up. I can't tell you how thankful I am. I forgot
I'm
completely.
sending notes to Faith, like, don't let me forget. The first one, these are all to the Children and Families Prevention Advisory Board. I think all of ours are. The first one I have is Amy Davenport. I thought I reported her last year, but I guess it was 2 years ago. Amy is known to some of us. She was in the House for a number of years. She actually read law according to Vermont laws and passed the bar and became an attorney. Was elected to the House with Francis Brooks. They turned a Republican Montpelier into a Democrat Montpelier. She was in the House. She was appointed to be a judge by Madeline Cunin. She did a lot of work, I know, in family court. She eventually became the chief supervising judge. She's been on here for a number of years. She loves it and she would like us. So I would like to move that we confirm the appointment of Amy Davenport to the Children and Families Council on,
For prevention programs,
yeah, that one.
that one. Okay, discussion. Amy Davenport's been nominated. All those in favor of taking her confirmation to the full Senate, please raise your hand and say aye.
Aye.
Aye. Opposed? All right, so Senator Cummings, you'll send that up.
I will send that. I have a second one.
Go ahead.
Amy got right back to me. This one I finally called. This is Henri Sparks to the same council. When I talked to him, he's very good. He does know he's being appointed. He is the director of equity for the Burlington school system. He has 26 years in education. Before that, he was neighborhood coordinator and youth advocate for the city of Burlington. And he said he'd like to see the council do more to combat racism and then bullying and harassment in the schools. And I would like to move that we confirm the appointment of Henri Sparks to the Children and Family Council for Prevention.
Okay, discussion, questions? All right, so Ollie Sparks has been nominated to the council. All those in favor, please raise your hand and say, to send this to the full Senate. Raise your hand and say aye.
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 Okay, I have a nomination to the Children and Family Council for Prevention Programs. The person is Karen Vastine. Some of you may know her. She's been working on juvenile justice and juvenile justice reform since 2007 and 2019, co-authored the plan to raise the age of juvenile court jurisdiction to include 18 and 19-year-olds. During the same period of time, she participated in projects and subcommittees of the council, including ethnic and racial disparities and juvenile court jurisdiction. And during her 5 years as a senior advisor to the commissioner of DCF, she supported the council through supervising and the coordinator of the council, presenting workshops and facilitating retreats. I have worked with her for several years. She places high value on the work of the Prevention Program Council and is excited to be able to include being a part of it. So, any questions? Okay. So Karen Vastine's been nominated to the council, and all those in favor of sending her name to the full Senate for confirmation, please raise your hand and say aye.
Aye.
Aye. Oh, good. Good work. Excellent work. Thank you
Just reading
all.
the floor schedule and realizing my schedule has been destroyed for the week.
I know. I know everybody's schedule has been destroyed for the week, but thank you all.
Okay,
Thank you for all your work that you've done today on the resolution. And Ruth, good luck with the floor. If you have questions, reach out. We can have a conversation.
Yeah, sure thing.
Yeah.
And just let me know when you hear from Senator Terenzini.
I sure
and I'll
will.
Send it to
Yeah.
Bloomer. And on Wednesday, which bill are we meeting on with judiciary?
I believe it's S3, which is a consent. No, it's not the
oh,
consent.
the one that was on the floor?
It's the ONH bill. It's a mental health bill. It deals mostly with studies and orders of non-hospitalization. The House sent it back with a huge amount of just straight mental health, not judicial mental health issues. So I have worked with the chair of judiciary and putting together something that we think fits more with the judiciary role, and we'll be looking at that on Wednesday.
Okay. It's not one of the bills that went through our committee originally, is
I
it?
don't believe it is. I don't believe it
Okay.
is.
Okay. All right. Thanks.
All right.
Okay.